The flames may be gone. Rebuilding is beginning yet, though, for fire victims. The mental health battle is continuing to rage. KCAL News anchor Juan Fernandez recently spent time at a local nonprofit, Medical Mission Adventures, and it's a mission that's offering support.
I'm used to difficult situations, but there were days I could not get out of bed. I could not stop crying. And there was this weird moment after we finally felt safe when our mental health started tanking.
Brecken Armstrong has seen it all as an ER doctor until the night of January 7th. She and her husband Martin lost their home in the Eaton fire. The frightening memories of that night still haunt them.
I drove through 90-mile-per-hour hurricane-style winds. Didn't know what I was going to find when I got home. Our cell phones weren't working. So he found out about the fire from a security guard.
He said, "Leave now. We will not be back." Went down to the end of the street, and houses at the end of the street are on fire.
4 months later, the Armstrongs are still struggling. Even the smallest of things can trigger memories and nightmares of that fateful night.
Just a little tea light in a restaurant was enough to set us off. Visions and dreams of burning alive, having my feet stuck in the ground, unable to move, and the fire coming towards me and burning, my toes burning, my feet burning, my ankles, and having it engulf my body. And this was the nightmare multiple times every night.
The Armstrongs knew they needed help. Luckily, they found Medical Mission Adventures. The nonprofit began as a medical mobile clinic. They eventually jumped in to help victims of the Maui wildfire. That's when Dr. Evelyn Wong says she knew they needed to expand their mission.
What we realize is the great need for mental health. A lot of times people don't realize that when you go through something as traumatic as what they've gone through, and now at the LA wildfires, it's not just a one-day event, but it is an ongoing disaster.
What makes MMA unique is their ability to travel directly into the disaster zones to provide assistance. They initially focus on providing psychological first aid, immediate support after a traumatic event. But they've learned that the real mental health challenge often comes long after many others have forgotten. About a year later,
we see suicides go up, we see homicides, we see child abuse, domestic violence abuse, addictions rise dramatically at the 1-year anniversary mark.
Esther Lee says that's why the real work needs to take place now.
Before those triggers happen, we do want there to be scaffolding and education so that they feel equipped enough to say, hey, you know what, we're prepared for this.
Dr. Armstrong says it's important to ask for help.
There's no shame in asking for help, obviously. No, not at all.
No, but when you're used to being the one giving help, and then all of a sudden you have nothing to give, then it's time to receive. And that can sometimes be scary.
Toby Nishikawa says MMA is always looking for ways to provide long-term assistance.
The resiliency groups are like the support groups that we're going to be having. It's a way through community and through sort of a lived common experience that everybody's gone through to support one another and build resilience.
Dr. Armstrong says she knows recovery is still a long road ahead. And as long as we're not afraid to ask for help during the darkest of times, there is light and healing on the horizon.
Every single one of us almost died multiple times that night. I was so traumatized by what I experienced and being stuck in the flames that I started on medications. I started 3 times a week trauma therapy, and I'm getting better.
Well, that's good to hear, but it does sound like there's a long way to go. Dr. Evelyn Wong will join us in the next hour to talk more about this work the organization is doing. If you'd like to help, you can donate now to Medical Mission Adventures. Simply scan the QR code you see on your screen. You can also go to our website, kcalnews.com, and click KCAL Cares. If you or someone you know is struggling or looking for help with mental health, we have a full list of resources on kcalnews.com/mental health awareness.
Yeah.
Dr. Evelyn Wong is the Executive Director of Medical Missions Adventures. She joins us to talk about the incredible work the organization is doing. Thank you so much for being here this morning.
Thank you for having me.
You know, I do think you hear that story, and you have to take that and compound it, you know, by thousands of people and what they're living through. Can you talk about the impact that you're seeing with the survivors who had to watch so much destruction?
Yes, I think I think people don't realize that as time rolls on, people forget about this disaster, and survivors are left with not knowing what to do. And I think that's why we want to position ourselves to help. They found that people a year out of any disaster, especially wildfires, they tend to, we see spikes in suicides, in homicides, drug abuse, and domestic violence, child abuse. And so that's why we want to get the word out. And I really appreciate what you guys are doing with this Mental Health Awareness Month, is that we are getting the education out to let people know that there is hope and there is healing.
Absolutely. And that's the thing. I think hearing from people now about what they're going through, especially for those who didn't experience it, many people who haven't gone through something like that think, okay, well, the fires are over. Everyone's fine now.
They're
and that's
rebuilding.
why,
Things are moving forward.
Hearing from a woman like that saying, listen, when it ended is really when things got bad for her. This is long-term recovery, the issues we're talking about.
That is correct. That is correct. And I think that we want to be able to position ourselves so that we can be of help. And especially if you have been affected by the fires, we just want to let you know that we've not forgotten about you and that there is help. LA County Department of Mental Health is also positioned to help. And there's a lot of organizations who have come together in collaboration. I think in responding to disasters, I've realized these are the worst of times for people, but this is the best of humanity coming out. And as we saw, in the early stages of this disaster, people were donating tons of stuff. They looked in their closets. There were, we had tens of thousands of clothing just piled up at the Santa Anita racetrack. People are looking to help. And this is the beautiful thing about our organization, is that we have medical professionals, mental health people who are saying, we want to be of help. How do we plug in? And there's something about when we give of ourselves, there's a destiny and a purpose where we can step into that place and actually offer the gifts and talents that we have. And so that's why I think that this Awareness Month is so crucial, is to let people know, especially those affected by this disaster, that we're here and that we want to get the word out.
Well, and that's just what you're talking about, doing some of that work or volunteering, those types of things. That you read so much research about how gratitude can actually carry you through some of those tough mental health times. There are a lot of misconceptions around mental health. I'm somebody who liked to compartmentalize things for a long time, didn't think I needed help until I really did. So can you help clear up some of the common ones that people often kind of throw out there? One of which, mental health conditions can't be prevented. That is a myth, correct?
That is a myth. That is correct. Well, not all cases lead to not all cases lead to chronic conditions. But if we can have early support, surround you with community and the environment and education, we can prevent people going on to having PTSD and mental health. And I think that's why in the very beginning of this disaster, we were offering psychological first aid, which is basically being able to get in there and tell people, like, it's okay. Like, our brains are amazing. When we come across a threat, for example, you've heard of fight or flight response. And so that's a natural reaction. When we see a bear start chasing us, we don't sit there and think, oh, what should I do? We automatically pick up our feet and we run. Our hearts, our blood pressure, everything elevates so that we can get away from that potential disaster. But what if you can't turn that off? All of a sudden, something triggers you. You might see, or for example, with this fire, you might smell a little bit of smoke. All of a sudden, that same fight or flight response happens, and we start having anxiety and panic attacks. We can't sleep. And so there's different techniques that we can try to help people calm down their nerves, and basically to tell our body, our parasympathetic nervous system, to say it's okay. We could do breath techniques, breathing techniques. We can do something called EMDR, and we have trained professionals who can help you in that. And so that's why I think that this whole thing about not being able to prevent, we can get in there early, and the quicker we get in there, the least likely people are going to go on to develop PTSD.
Yeah. Really important.
And though it's amazing, Dr. Wong, as many conversations as we have around mental illness and mental health, there's so many misconceptions and myths. I know you tackle a lot of those on your website to try to get people to understand more about this. So we're going to send people there. And thank you so much for the conversation this morning.
Great.
For more information on medical mission adventures and ways to donate, you can check out our website, kcalnews.com, and click Seen on TV.
And if you or someone you know is struggling or looking for help with their mental health, we do have a full list of resources on kcalnews.com/mental health awareness.